Hello, this is Kimberly Diaz, and I wanted to talk about the SLUMS test. A lot of families ask me about the scoring of that, the assessment, what it actually stands for. So it stands for the St. Louis University Mental Status Exam. It's one of several cognitive screening tools that healthcare professionals may use to help identify possible changes in memory, thinking, attention, executive function, and this test looks at areas such as short-term memory, orientation problems, solving attention, recall, clock drawing, and comprehension. The scoring can help providers determine whether someone appears to have normal cognition, mild neurocognitive impairment, or more significant cognitive concerns. But this is the important part that I want people to understand. A SLUMS score alone does not diagnose dementia. It is only one piece of a much larger puzzle. As a dementia consultant and nurse, I often remind families that there is no single paper test that can definitively diagnose dementia. Cognitive testing must always be looked at alongside medical history, medications, labs, imaging, functional changes, behavioral changes, caregiver observations, and sometimes additional neuropsychological testing. Something else many people do not talk about is that some individuals can actually begin to memorize portions of these types of tests over time, especially if they're taking them repeatedly. That's why experienced clinicians use a variety of assessment tools and observations rather than relying on one score alone. I've also seen people score poorly because of anxiety, hearing impairment, stress, poor sleep, education differences, depression, pain, or even being in an unfamiliar environment. And I've seen others score fairly well while still struggling significantly in daily life. This is why a thorough assessment matters. There is no one-size-fits-all approach to cognitive health, and families deserve thoughtful evaluations, not just labels based on one test score. Early conversations, proper evaluation, and looking at the whole person are truly what matter. This is Kimberly Diaz, helping families stay anchored while transforming the dementia journey. I also wanted to share with you that I have a new tool that is free for you to go ahead and check out. It's called agingparentstoolkit.com. It's about a 2-minute quiz. It can help identify your caregiving type, what type of wounds you have from living with your parent and being raised by them, and then provide some really good resources to help empower you to have compassion while still caring for your loved one. Take care until next time.